love we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough and it seems like your best ain't good enough, if you're in need of hope, you know where I'll be. I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful best day ever. And for those of you who are tuning into the classroom for the first time, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, as you know, it is very, very difficult when anybody is feeling pain to focus on anything else. If you're walking down the street and somebody says, how are you doing? You immediately have to tell them about the focusing on the pain. Well, as you know, in the classroom, we focus on what we want. And if you want to get rid of the pain, you focus on your body being healthy and healing and all those things. But it is very difficult. It's, some people say, easier said than done. But if with programming, rewriting of the brain and rewriting of the story of your life, perhaps it might be easier than you think it is, or you might even want to try it, for example. And so when I stumbled upon the work that John Sarno did a long time ago, I also stumbled upon Steve Ozanich, and he lived with pain for, I believe, over 20 years and tried, and as you know, you will try anything and everything to be pain-free, only maybe to be disappointed when the pain returns. But once the student is ready, the teacher appears, and this is where Steve comes in. The teacher appeared when that student was ready. When he was ready, he started learning and growing and learning what the root cause of pain from a wonderful teacher I mentioned before, John Sarno. And so we're going to be talking about that today. So I'm going to have you be very, very curious instead of critical, because some of the things you hear today, you know that. You've been listening, you know about this, but some might be new to you. And for you, I am asking you to be curious instead of critical, because we're going to be talking about something called TMS. And I've heard TMS in many different ways, but this one is called Tension Myositis Syndrome. And so stay tuned, because since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Steve Ozanich is here to do just that. Welcome, Steve, to the classroom. Oh, just in time. Oh, you there we go. Welcome, Steve, to the classroom. I'm so glad that you will be able to join us today.
Well, thank you for the invitation and the opportunity to help some people.
Absolutely. That's what we're here for. We both have very similar values, and I am really grateful that right away. So full disclosure, I was so impressed with the information that we reached out to Steve, and he immediately replied. So normally I have books and I have all these things, but this time we're going to learn 101, TMS 101 together. So Steve, share a little bit about your background and what led you to TMS, and what I say becoming a TMS whisperer was what I read on your website.
Okay, sure. I spent 30 years in intense back pain, among other health problems, of course, because it's usually not held in isolation. Usually people have 50 to 100 health problems. because they're all essentially coming from the same source. But my main symptom was back pain. And of course, it waxed and waned through the years, and I had tried everything that everybody tried, core strengthening, physical therapy, acupuncture, hanging upside down on an inversion table like a bat. Everything but surgery, which was one of the smartest moves I ever made, was not to get operated on.
Yeah.
And so in the late 1990s, it became extremely severe. I mean, it had me debilitated my whole life, but in the 90s, it was it. I had lost 50 pounds with weight, and my left leg was partially paralyzed. I had foot drop. I lost the deep tendon reflexes in that leg, and the sensation. The only thing I really had was the quadricep and my knee. So I lost my hamstring, calf, and foot. And so I dragged the foot around for months until I finally got to a MRI, and of course it showed a pinched nerve, which it's ostensibly a pinched nerve. There's nothing being pinched there, by the way, but it looks like there's no route for the nerve to come out of, and right at the same level. And so it all makes sense why they think that something's being pinched there. And so I was weeks away from a surgical consult, and I was introduced to the work of Dr. John Sarno, who forever changed the world with his discovery of TMS. Now, I got his book and I started to read it, and I thought he was crazy. So I threw the book against the wall and just went right back to physical therapy, and I got worse, of course. And when I got really desperate, because desperation breeds open minds,
That's right.
I went and took a better look at it, which I hope anybody listening does, because it will save their life. And I saw the beautiful truth in it, and I began to heal after 30 years, and all of my other health problems healed. And so I ended up trying to explain it to people, and anybody who was willing to listen, of course, because very few people believe it, but it still works every time. And I had so much success with it that they talked me into writing a book on it. So I wrote my first book called The Great Pain Deception, and I ended up writing a second book in homage to Dr. Sarno. And then I wrote a third book to say a little bit more about how people really don't want to heal, because the answer is right here, and how the medical industry is wrong and how Dr. Sarno is right. It's more of an argumentative book. And I've spent the last 23 years, this year's my 23rd year of being pain-free and symptom-free, doing whatever I want, lifting, running, golfing, and helping tens of thousands of people to heal from this thing we call TMS, which has actually evolved through the years. We no longer call it the Tension Myositis Syndrome, although some people do. We call it the Mind-Body Syndrome now, TMS, because at the end of Dr. Sarno's life and career, he realized it was more than pain. It was more than muscles and nerves, which is what myoneural means, that it was the immune system, and MS and cancers and dermatological things and digestive things. And so it was so all encompassing that the TMS was a good term for it. Of course, we've teased people about that phrase TMS. We mess around with it a lot. Dr. Sarno laughed when I told him I got email from the Texas Motor Speedway. But teach me something is a good acronym. Or too much, Steve, I say sometimes. But whatever you want to call it, almost everything we experience in health is from a mind-body process. And it works virtually every time. We have to say the word virtually, because it doesn't work if the people don't believe it.
Correct.
There's a huge caveat there. It works literally every time, except if you don't believe it, and most people don't believe it. And so there's a narrow group of people who have a level of consciousness that they can see what's going on here, and they heal. And so it is a gift that has saved so many lives. I've got emails from people who were healed from cancer with my first book, and MS symptoms, and all kinds of eating disorders. And a lady I just helped get her hearing back. Her hearing disappeared. So, it covers basically everything, which sounds too good to be true. What they say, if it's too good to be true, it probably isn't. But this is. It works. It actually works. But, sometimes it can get more complex with childhood trauma and childhood abuse, and severe emotional abandonment. Sometimes those people need a little extra work and care through psychotherapy or some type of trauma program somehow, but most of the time they don't.
So, when you talk about TMS, there are a lot of different acronyms because I remember there's one that's called transcranial magnet stimulator.
Oh yeah, that's one that
And
can
let me tell
confuse
you,
them.
my dad had that. And shortly after he did that, he had a stroke. And I'm not saying that it was that, but I'm saying, I wonder, which came first. Did my dad have the predisposition to have a stroke, and it was it was not mild at first, but then he recuperated 100%, other than the damages that happened to the brain. And also, I also saw tension myositis. Is that what is myositis syndrome? Is that something different, or
That was Dr. Sarno's first publication in the late 70s and early 80s. He called it myositis for muscle. And then it advanced to myoneural, then advanced to the mind-body
MindBody?
syndrome.
Amazing. And it just all fit in. It kept fitting in with that TMS.
Yes.
It's it's like it's like, okay, is this what it is? No. It's like we're God is showing us, right? And the TMS, we've got the TMS, but is it this? No. Is it this? No. Now it's that mind-body syndrome. Okay,
Right.
so with that in mind, as we look at this, I want to go back to your childhood, because you said you've had pain since your childhood. Was there anything in your childhood that could have said, oh, that's why you have back pain? Did you get hurt playing football? Was there something that made a physical pain logical?
Sure. It's different for many people, but it all leads to the same center with everybody as well. In my case, well, it has to do with TMS itself. Dr. Sarno was very frustrated with his results. He was a physiatrist at New York University Medical Center, and a brilliant doctor, but he was very frustrated with his results. He wasn't getting any good luck with his surgery and his therapy or anything that they were doing. And as a good healer, he wanted to know why. And so he went and looked at his patients' records, and he saw, oh, these people have a lot of other health problems on top of back pain. They have allergies and skin problems and sleep problems and things like that. And so he began to talk to his patients, which you just don't see today.
Right. 7 minutes.
People, yes, 7 minutes. That's right. I had quoted that in my first book, and the editor cut it out.
Really?
But I have people tell me my doctor never looked at me. Came into the room, looked at the chart, scribbled out a prescription, and walked right back out to the next room, which is it's really disastrous today, right? But Dr. Sarno was old school because he was an old man. He graduated in 1950 from medical school. So he began to talk to his patients, which was, wow, what a thought, right? And he saw patterns and tendencies in these people. These people are goodists. They're anxious, they're worriers, they want to keep people happy, they push themselves very, very hard to be liked. They are perfectionists. And so I fit all those boxes. And so as a young child, I wanted to, play sports. In school, I wanted to get straight A's and be the top athlete and all those things. And so the self-imposed pressures on myself to not fail, to succeed, were just too much at some point, which he proved clinically enrages us to no end inside. We absolutely have these high levels of anger when we're perfectionistic and trying to be good all the time and trying to never fail all the time. And, basically what Freud and Jung talked about, these false masks that we wear as human beings.
Mhm.
We get tired of putting this mask on and pretending to be this person that we're not. And so the conflict becomes tremendous at some point, and the emotions rise. And so what the brain does, he proved clinically, is it creates a physical symptom so that your awareness will be diverted to your physical body and away from the rising anger. And so at some point, I was playing sports and in school or whatever, my brain just decided it didn't like what was happening inside. And so it did me a favor. He calls it a favor. Your brain is doing you a favor to help you avoid the unwanted, seeing a side of yourself that you cannot allow other people to see, right? This dark, shadowy side that Jung called a shadow. It did me a favor. Of course, people say, how do I tell my brain to stop doing me favors, Steve? But it's true, but it is trying to do you a favor. It just created this pain so it would divert my mind's eye to my body, to my body, to my body, to my body. And with the help of many, many healthcare practitioners, they had crippled me by telling me I had stenosis and arthritis and scoliosis and spondylolisthesis and herniated disc and prolapse disc and sequestered disc, or whatever label they want to give it. And it was all wrong. It was all wrong. I had hundreds and hundreds and hundreds of chiropractic adjustments, and everything feels good for a little while.
Mm-hmm.
Everything does. But nothing was lasting until this crazy concept called TMS. And I've literally seen probably over 100,000 people heal from it, and yet most people still don't believe it. And there's a reason why, by the way. There's a reason why if you want to talk about it, but I don't know if that answers that question.
No, that's really good, because it does. And we become medicalized. And that is one of the things that I was as a child. I was medicalized with asthma and it just took me being ready for Dr. Andrew Saul of Food Matters. I don't know if you ever seen Food Matters, but he was someone I was interviewing. And before we went off the air, because I was doing radio at the time, before the commercial break, he said, Lily, I can get rid of your asthma. I can help you get rid of your asthma. And I was like, bring it. Because at the time I was ready. The medication they were giving me was compared to chemotherapy. It was a suppressant. I don't know but the closest to the CPT code for billing was chemotherapy. And that's when I received my explanation of benefits. And that rocked me right there when I saw that on the explanation of benefit. And that's when Dr. Andrew Saul came into my station. This is, I'm ready. And that's why I said, we need to be curious, because the critical side of me, I mean, if I were to talk to you 13 years ago, we probably wouldn't be having this conversation, because I was medicalized. I was told you take a pill if you have any ill. And my registered service mark today, this is how different I am today, is that you can take a pill or you can take responsibility. And it's not that I am against the pill, because we we look at pain in the body as the problem, but that's our body whispering to us. If I were to look at what you're talking about, that's the body whispering to us, and it's a symptom, not the diagnosis, right?
Exactly.
Okay. So when I have learned about this a long time ago, but I've never heard it said like you have said it and you explain it. But this is what I've known, that the spirit, the same cell that made the brain, that made the heart, that made the gut, they are in constant communication with one another. The brain knows that there's pain that it doesn't want to deal with, maybe the ego. So it creates an illusion. It creates something else. The body wants to be in alignment with the brain. So if pain is what we're trying to avoid, pain is what the body gets. But you say that is to help, right? The body can you explain a little bit more about how it is that the body is trying to honor? Is it the brain?
Well, we talk about the mind. It's not the same as the brain. The brain's
Okay,
an
the mind,
organ.
yes.
Brain regulates consciousness. It allows us to see certain things, but it also prevents full consciousness.
Mm-hmm.
We can't see everything, which we agree to when we come to Earth, of course. But the brain, now this is what Dr. Sarno is hypothesizing, that the brain will reduce blood flow slightly to an area in the body, shoulders, knees, feet, or whatever, which carries oxygen, blood carries oxygen, to create a severe situation that he called the most painful thing he'd ever seen in clinical medicine, ever, TMS. To make you rivet your focus and attention to your physical body. And so he said you could see it as a diversionary tactic or strategy or a distraction. That's a hypothesis, but it makes sense because when we explain to the people what's going on, it goes away, which means we've blown the ruse of the brain. We've blown the covert tactic of the brain off, and yet the herniation's still there. The rotator cuff tear is still there. The meniscus tear in the knee is still there. The plantar fasciitis, they're all still there. The arthritis is still there, and yet the person still heals, which is clinical proof these things are not causative factors of pain. They are source destinations, because the mind, which Yogananda told us resides on the surface of the body, it's aware of all these changes. It knows the herniation, it knows this, and it uses these things to more firmly convince you that there's something wrong with the body. And I have seen the most amazing healings, and when they occur right in front of me on Zoom, it's just mind-blowing. 10 years of crippling pain, they'll start crying. It's gone. It's gone. Now that's rare. That's not common. It usually takes a week or day or a few months, and years if it's really bad. Mine took over a year because I didn't have anybody like me to go to at that time.
And you were still dealing with your disbelief.
Yeah, I threw his book against the wall, called him a few names, and he got called a lot of names by people. Except when you heal, you begin to love the man deeply. I fell in love with him. He saved my life. When somebody saves your life, you tend to fall in love with that person. And but he was a very humble man. He took it in stride. Oh well. He would say, oh well. It was just a beautiful human being. But I mean, when I mainly wrote my first book, The Great Pain Deception, for pain. But I was a little surprised when they started coming to me with other healings. People were telling me their sleep problems disappeared, their lifetime of infections went away, their skin problems went away, vision problems. Sometimes people don't need glasses anymore once they heal completely. And so everything, basically, at some point. And so anybody, I would say this, and I heard you say this word, by the way. My third book is centered around that word you said a few minutes ago, readiness. You told me, you were ready at that time, because without that, it's not going to happen. Now, David Hawkins called it willingness. If you're not willing to heal, it's never going to happen.
Correct.
If you're not willing, and Yogananda said, if you're not willing to be happy, you're never going to be happy, right? Well, you can't raise your arm without willpower. And so the person has to be willing and open to accept this. And if they do, it will work.
It's amazing that that simple shift of that willingness, and I don't know what was going to happen. I did not know what would happen after I got off of these. These were major drugs. I wasn't living a quality life of asthma drugs, and even with the Xolair that I was on, I still was on rescue inhaler, and I still was on other things, but the quality of life was much better because of the Xolair. But let me tell you, you get those feelings that it's like something's got to change or this is going to kill me. And that's why I'm so passionate about what I do, just like you are. Once you experience the body returning to where it needs to be, because now you're giving the body what it needs, then actually when you give the spirit and the mind what it needs, the body will return, because you'll start acting like it. And so that happened to me. And once you start seeing this, you go, okay, well, what else have I been lied to? What else is out there? And all of a sudden your pain turns to purpose, and you become unstoppable. So with that in mind, and I've had multiple doctors come on. I don't know if you know Dr. Lee Cowden. He says, people spend a lot of money trying to fix the body, but if they would just take the time to dive into their mind and their spirit, the body will heal naturally, because you start giving it what it needs. Many years ago, I took a course with Mona Lisa Schultz called Medical Intuition. And these are the chakras. And to the one side, it talks about the health problem, but the other side talks about the emotional issues. And every single center, it's a chakra, it's also a healing center. And so I've researched this. And so when I coach people, I coach on it, but I had never heard I didn't know what John was doing. I did not know that you were doing this as well. So I was very curious. So I wanted to talk to you about the process. Is there a process that you go through, like a, A to Z, or 1 to 5, or 1 to 10? Is there a step-by-step instruction in your booklet? Because I'm looking forward to reading it. No. Okay,
No.
so let's talk about maybe some of the questions you ask yourself, because we're being told, I have 4 herniated discs. We're being told I have asthma, or you have cancer, or you have an autoimmune condition. I'm going to be interviewing, she's been a regular on the show, Dr. Terry Walls. She reversed her MS. And so there's all these wonderful people that are reversing it, but no one is saying, what is it? Is it the food that they're eating? Is the way that they're thinking? Is it the traumas that they're releasing? And so I work with people on this, but I've never heard about it as a process. I just thought it was through my intuition. So I would love to learn more about the process. How do you start the process?
Okay. Yeah, there is no steps because everybody has a different hole in their consciousness.
Okay.
So I try to ascertain from them their level of understanding TMS, first of all, and then their level of understanding themselves and their life and how they react to life. Because people are different levels of consciousness. That's simple. Some people very low, some people very, very high level. And so the conversations can go wildly, drastically different. If somebody comes in here and they know all about, Yogananda and David Hawkins and autobiography of a yogi and Buddhism and Christianity at deep levels, then we talk that level. I'm often told by people I work with that I do this all the time. I didn't know it, but people started saying, "Why are you doing that?" I said, "Do what?" "You're doing this." I said, "Oh, I didn't realize that." I'm meaning the alignment of the mind, body, soul. At some point. And of course, Anita Morjani's become a friend of mine. I'm doing her show in September again, the Magic Hour.
Nice.
And she says she got sick because she wasn't living a life true to the alignment of her soul's mission here, which is exactly the higher level of understanding. We are not this body, we are not this mind, okay? But some people don't quite see that yet, and so we work at the level of TMS level and the current state of the medical healthcare system and things like that. If they believe that certain food or a certain drug works, it works. And so belief is the key here. Belief. If you believe that a herniated disc causes back pain, you will stay crippled forever.
Right.
But there's not one study that shows that they do cause back pain. As a matter of fact, every study shows that there's no linkage between them, that people still want to believe that side, even though the studies show that they do not cause back pain and stenosis and things like that as well. But it's just the reason they don't believe it, maybe we should talk about that, is the very reason that they have it. Remember, it's pain or disease, they're blocking a radical truth that wants to be known, or they're diverting awareness away from things that we don't want to know, okay? There's a reason these things come up. And so if your brain is creating the pain or disease to prevent you from knowing something that doesn't want to know, why would you believe in TMS then? Because it's helping you. It's like you think of it as an emotional crutch. And people don't want the crutches kicked out from underneath them. They need them to walk. There are a lot of people that would prefer to limp for the rest of their life, and keep this truth hidden, that maybe their marriage has failed, or maybe they hate their job, or maybe they hate this or hate that. I don't know. It's so varied. And so it makes sense that you do not want to know about this truth because it's blocking something you don't want to know. Right? And so it makes sense to me. And of course, I never get down on anybody who rejects it. I have a really good case recently. It's so fascinating about an eating disorder this kid had in Wisconsin. He was really thin. I mean, his face was emaciated like an Auschwitz prisoner, And he proceeded to tell me that when he ate certain foods, he'd have a reaction. And of course, he went to a doctor who led him right down the wrong path, the blind leading the blind into further darkness. And the doctors told him he had a histamine intolerance. And so all food has histamine in it, but some has low histamine in it. And so his doctors told him that chicken and rice had low histamine in it. So his mind had him convinced that that was all he could eat. And so for 5 years in a row, he had only been eating chicken and rice every day.
Oh boy.
But that explained the thinness. But he said, that's not why I'm here. I said, really? He said, no, I'm here because during this time I went through a car wash and they put that cherry smell on top of the car. And he said it triggered a chemical response in his nose. And he said it was like they took a bucket of molten lava and poured it over my whole body. Every nerve was on fire. Now I've seen burning mouth syndrome, burning arm syndrome, burning leg syndrome, but I've never seen it on a whole body before. But of course, I told him there's no such thing as a histamine intolerance. There's no such thing as a chemical sensitivity. These are mind things you have bought into with the help of your physician. Well, he didn't like the way the consult went. I was talking about, yogis and, this and that. And he sent me a very nasty email the next day explaining how I didn't know what I was doing and all this. And so I reacted with compassion because I rejected the message too.
Sure.
And so I sent him his money back even to make a point with him. And he healed shortly after. And so he sent me the money back in a beautiful letter, how everything disappeared. 15 months of migraines, the insomnia, the histamine thing, the chemical thing, all at one time. Because, he rejected it because that's the normal reaction, to reject the truth.
The ego doesn't want us to be happy.
Absolutely. Remember Wayne Dyer called ego edging God out.
Edging God out, yes.
And God wants us to be happy, right?
Absolutely.
And so, yes, I mean, I get spit at and middle finger given to me all the time, I just spoke at Ohio State University to this Genius Network group. And when I was done speaking, I didn't know how they were going to take it. They looked pretty bored. But the lady, the first lady spoke up and she said, what you just said would be the most insulting thing I've ever heard in my life, except it worked for me. She had brain pain, I guess, and the work had worked for her. And all these people came up, some of them in tears, crying. You just solved my lifelong health problems, why I can't find an answer. All these things like trigeminal neuralgia across here, women get that 10-to-1 over men. 10 times the rate that men get this right here. Okay, and there's a reason for that. They tend to, not always, but generally speaking, women tend to want to be nicer than men. They don't think they can just speak up like a man, so they clench the tension in their jaw. Remember, the T stood for tension. We're talking about tension here, right? And if you resist the expression of yourself, it starts to fire this amazing pain across here. And the same thing's true for heart attacks. It's a tension event, There's a guy that sent me his book recently. It was pretty interesting, called The Death of a Cancer Patient. Oh, there it is. I shouldn't be promoting someone else's work, but
no.
Death of a Cancer Patient. See, he crossed the word patient off, so it says the death
of cancer.
He was 36. He was dying from stage 4 cancer, but he's perfectly healthy now because he recognizes it's not being a disease, this misalignment of the spiritual being. And so he's fine now. And so anybody who's ready is going to heal. I should say anybody can heal. I don't know if everybody will heal because we don't know what the soul's purpose is. It might want to pull out of this life at some point. We have no idea, right? But for the most part, people can heal. And Anita Morjani is a great advocate of Dr. Sarno's work, and she's trying to help me. And she's a beautiful human being, by the way. And
she is. I heard her speak at an I Can Do It seminar that they had in Orlando, Florida. And she was great. She was great, very peaceful. And I remember Wayne Dyer introducing her, and she's just an unbelievable woman. Love to have her on my show. So if you have any connections, let's make it happen.
I mentioned sometimes to people, she said, I'm booked 3 years in advance.
Yeah.
Well, I'm just throwing people at you just to suggest is all.
Yeah. But, well, she is a beautiful soul. But here's the thing, that we don't know what we don't know. We don't know what we don't know. And I have to be very careful too when I start digging into the healing centers and where the disease is. That's where the direction I can head in. That it's just a wonderful guide for me as I coach people. But some people who have friended their disease, they call it my disease. It is, nothing can change that. This has nothing to do with that. A behavior has nothing to do with this, or a belief has nothing to do with this. And it takes a while. It takes a while to you have to figure out different ways to kind of get them to the same destination. But what they hear, the ones that are offended right away and defend that what they have has nothing to do with an emotional issue, they have a diagnosis, which is the biggest problem that people could have, is a diagnosis. And that's what they believe. So am I hearing you say that the reason why they believe this is because the ego won't allow it, because the ego wants to remain, angry or hurt or a victim, or what?
Sure. The ego is basically a circulating thought process. It's how you see the world. And my ego is how I see the world. Your ego is how you see the world, right? And so if it doesn't fit in with how they see the world, it's rejected immediately. And we call that, it's an ego rejection at some point. But I think most people are offended because what somebody says is often different than what the person heard. Okay. And that's what we call poor communication at some point, right? We're trying to communicate it well here today so people understand it without being offended, right? But when I say, this is a mind-body process, a lot of people hear you're telling me I'm making it up in my head,
Exactly.
that I'm lying. That's not true. We are not saying that, by the way.
No.
There's a lot of things that the ego likes to assume. And by the way, you're right. It loves suffering. It loves anger. It likes conflict. It loves these. This is its very food. This is what it lives on. It's never going to give those things up. And so, but they do become identified with it. I realized that right away when I published The Great Pain Deception. I was so excited because I'd helped all these people from fibromyalgia to heal fast. Some of them on Zoom, right? So I went to the fibromyalgia group on, I think it was Facebook at the time, and big mistake. I went in there. I said, "Listen, I can help you. I've seen it. I've witnessed it. I've done it." They came at me like wounded badgers, and it took me a while to reflect on, well, what had just happened here, And I saw it once I pulled back to see the big picture. This little old sweet lady who ran the group, she reminded me of that little old lady in Tweety Bird with the bun on her head and the
Yeah.
knitted, And
Great visual. Thank you.
I'm looking at at their conversations. They're talking about the teas that they use and the types of pillows and all this. And I realized, oh my God, this is the very reason this lady gets up in the morning. She feels she's contributing to society. It's the reason she's living. And I'm coming here like a bull in a china closet, taking it away from her. And so everybody has a different motivation for what they do, right? And so Dr. Sarno told me, Steve, do not try to convince anybody. I've never seen it work. Conversion doesn't work. It's like trying to, burn people at the stake to believe in Jesus, right? You have to be ready, right, to accept a higher understanding. And so he said to me, there's enough people in this world, given only 1% of the world, that you'll spend the rest of your life, time, and energy helping those people. And he's right. He was right, by the way. There's enough people out there. I don't need to try to convert anybody. No. If you're ready, it's going to happen.
It will happen. And, some people say, oh, it's a placebo effect. Well, hey, listen, if placebo works, then take it. And, there's such a thing as nocebo, which means if you don't believe it's going to happen, it won't. And if you believe it will, which brings me to the mind. The mind is so powerful. It's the command center of our body. If our thoughts are thoughts of healing, then, then we will feel a certain way. We will feel empowered. And when we feel that way, then we will act a certain way. It's the anatomy of a thought, feeling, action. And it's just amazing to me that people would much rather hold on to their pain than explore what life would be like without the pain. And so before we continue and share Steve's I share Steve's information. I want to share that you can go to whenyouneedafriend.com. I want everybody to share this information, share this video, because this is information that is being suppressed in social media, in the news. You won't see this anywhere other than people that are promoting this kind of lifestyle, which is a healthy, natural, and really dig down deep. I call it a soul shovel. Take out your soul shovel and dig until there's only truth looking back at you. And so with that in mind, I want you to go to whenyouneedafriend.com. While you're there, please subscribe, like, and follow me on all social media, because you never know when I'll be off of social media. So make sure that you'll have a place that you can go to at whenyouneedafriend.com. Please share, like, and follow. Look at all the different workshops that we have there. Look at, as you know, we are in the middle of Super Gut, but you can join us at any time with Dr. William Davis. And in November, which is right around the corner, Dr. Bradley Nelson is coming to Cape Canaveral, Florida, where we're going to learn how to do the emotion and body code at the same time. This is being able to tap into your subconscious mind. So there's lots of things going on in the classroom. So take advantage of early registration, of all the different things that we do, because I love a good deal. Also want you to check out my sponsors. Support them the way that they're supporting the classroom. Go to my Shop Now bag. This is where you can get % off, the discounts, and all the different things that we look for when it comes to Lilly approved products from head to toe. So make sure you check them out. And last but not least, you can become an enrolled student in the classroom. As you know, everything that we do today costs more. And I need, if it weren't for the generosity of you, my listening and viewing friend, then the classroom wouldn't be able to happen. So I want to encourage you to be an enrolled student in the classroom, donate $1 or $1,000, a one-time donation, reoccurring, your time, your talent, your treasure, whatever you can give is very much appreciated. Today, we're talking to Steve Ozanich, and he is someone I stumbled upon that is very like-minded. We believe the same way, but we say it differently. And I was so curious that I reached out. Well, actually, we reached out to Steve, and he came on. He came on right away. So I'm really excited. And I know that this is not the first time. Hopefully the next time I'll have a copy of your book, and it's right behind your head, so people can see the book right there. I am looking forward to learning more, because I'm always curious as to, why do even myself, if I don't know if you are familiar with Zyto or Evox, or are you familiar with any of those? Okay, these are electronic, where it reads biofeedback type of thing. And it always comes back that I have anger, and I'm not angry. I don't think I'm angry. I think I'm peaceful. I think I've resolved a lot of issues in my life, but it comes back, and I'm thinking, okay, so if this is about when the student is ready, the teacher appears, let's talk about how do you tap into your conscious mind, subconscious mind, and start this dialogue of, how can I give my mind, my body, what it needs so that it will release the pain, release the trauma? What is the beginning process? Do you ask a certain question?
Sure. It's funny you say that line, when the student is ready. I have a new agent now. Eckhart Tolle's agent is my agent, because this is where Dr. Sarno's work was going, to the presence work. Okay. Presence is the only pathway out of this. Okay. I did it by accident. I didn't know what presence was, but I had to go back and reverse engineer it to help people.
Yeah.
But I changed that line in my book. I had written that 12 years ago, when the student is ready, the teacher will appear. And I realized, no, I see a little deeper now, because we learn and grow, right? We're becoming more conscious as
Absolutely.
we grow. I changed that to, when the student is ready, he will see that the teacher has been here all along.
Ah, I love that. I love that. Yes.
Because it all comes back to the prophets and the yogis and the people who already knew all of this healing stuff, right? And so as far as process, I'm getting the people who've tried everything. I'm last. They go to doctors first, then they go
Sure.
to therapists first, then they try drugs first, then they try therapy, right? So I'm the last person. And I hear this way too often. You're my last hope, Steve. And thanks for that pressure. Thanks a lot for that pressure, I tell them, But they're virtually all healing as well, because nothing's really more difficult to heal than anything else at some point. But I always ask them to explain TMS to me so I can understand what they see. And usually there's something wrong right there as far as their basic fundamental understanding of it. Usually, by the way, that just reading the book is enough most of the time. That's it. Dr. Sarno called it knowledge therapy. He said it is the knowledge of actually what's going on that is the healing mechanism. Now, of course, John 8:32 says, "Then you will know the truth, and the truth will set you free." That's just another way of saying the same thing, like you beautifully said there. You and I are talking about the same thing using different words. A
Correct.
lot of people are doing the same work. We're using different words. But then there's a lot of chefs in the kitchen, and so people tend to get confused. But that's the goal is the same here.
Hmm.
And so Quimby, the man who had created Christian Science back in the 1800s, I think it was, he said the cure is within the explanation. And so no matter which way you phrase it, it's the truth. It's the light of consciousness. That's how I like to see it. When I'm explaining to them, I'm just a teacher. I'm not a healer. I can't heal you. These people are creating the problem themselves. I love it when Louise Hay said that, all disease is self-inflicted. That's right. But they don't know it. This is where the problem lies. Like you said, you're not angry, right? That was the last piece of the puzzle for me. I'm not angry. Well, that's why, because I didn't understand what unconscious meant. Unconscious means you don't know it's there.
Hmm.
Okay. The body is expressing it. It's called somaticizing. The body is talking and it's angry in there, but you don't know it. And so it appears that when the person starts to understand deeper, in other words, if I'm explaining it properly, it's lighting that darkness, that unconscious side of them. The light of truth is kind of, putting a shine onto the darkness, and they're seeing, that's it. This aha thing at some point. Sometimes it's instantaneous, sometimes it takes quite a long time because ego can be very stubborn
It is.
at some point. And so different people need to hear different things. Some people, you can just tell them herniated discs don't cause back pain and they heal. And for some reason, and that drives everybody else crazy because it takes them a lot longer. Sometimes you need to explain to them that they are angry even though they can't see it, or fear. I prefer to talk about it in terms of fear, because that's where anger comes from fear. And so fear is a more important topic to talk about.
Okay.
And of course, unless you've read A Course in Miracles, you don't know what fear is. It's the absence of love.
Hmm.
Right? Because remember what Anita felt once her brain was gone. It was regulating consciousness, never ending unconditional love.
Hmm.
Fear is all gone, like David Hawkins talked about as well. And so there's many, many different ways to approach it. I often tell people I can explain it 1,000 different ways, but I don't want to confuse you. I can talk about it in terms of fear. I can talk about it in terms of love. I can talk about it in terms of anger. I can talk about it in terms of conflict, because they're all deeply conflicted people, deeply conflicted. They don't realize it, of course. And we all are at some level. There's so many people hire me right before their weddings, they're crippled with pain because they're conflicted, They love this person, but part of them says, I'm ruling out everybody else now at this point, But they don't see that. They don't want to see that side of themselves, And so
Hmm.
we're all conflicted at some level, And I mean, Dr. Sarno said to me, I have a lot of people in this middle age group come to me with chronic pain who are now taking care of their elderly parents, which is, I'm doing that now. My parents are getting older, and they come there because of the new demand made on them of this. But he said, when I can get them to understand, they don't give a damn about their that other shadowy side that Jung talked about, the id, or he called it an id, this dark side everybody has, we're conflicted. He said they heal. But they need to understand they are deeply conflicted. By the way, his last book before he passed was called The Divided Mind,
Hmm.
Divided in Conflict. Okay, or divided between conscious and subconscious, which you had mentioned there too.
Mhm.
So when you look at these things from a level of the subconscious not understanding or being confused or being frightened, when you start to explain to them that you're fine, relax, everything's good, the fear begins to drop in these people dramatically. And sometimes that's enough to help them heal. And so you never really know what that person needs ultimately. At some point, some people just, I had someone, I started something, by the way, called the Wall of Victory. If people can go look at that if they want. The TMS Healing Wall of Victory on YouTube. It's a long title, I guess. TMS Healing Wall of Victory. Everybody on that wall was told by their physician they would never heal, and they're all healed. Okay. Never listen to someone tell you that
I
you can't.
know.
Okay. Never. And
Yeah.
so there's some amazing stories on there, very fascinating stories. So, what we're trying to do is pump up their confidence in the diagnosis because everybody doubts. Everybody doubts. Even the doctors themselves, they get TMS. Oh, this could be real. This could be real. So don't worry about that. It's part of the process, doubting. That's the ego wants you to doubt at some point. And so go look at that wall and listen to these beautiful people talk about their stories because coming from the mouth of the person that it happened to, a lot of people connect with those people. I had a guy email, I said, "Thank you very much. You took my lifetime of pain away." I said, "Well, thanks for telling me. It's always fun to hear that." But I said, "Which of my books helped you?" I was curious. He said, "You wrote a book?" He didn't even know. He went to watch The Wall of Victory and he healed. So you never know which direction it's coming from.
Because something someone said in that video or whatever spoke to his essence.
Yeah, what he needed to hear, somebody said at
Mhm.
some point.
Yeah.
And it happens to me sometimes on occasion. They don't do too well, and they'll go find somebody else, and they'll heal from that person. I said, "That's exactly what I told you." They said, "Yeah, I know. It is, isn't it?" It's exactly what you said. But see, they weren't ready
Mhm.
when I told it to them.
Yeah.
I can explain exactly what people need to heal. It's not going to do anything until they're ready.
Okay, so we have about let me see, about 5 minutes left in the broadcast today. And so before we go, I just want to make sure that people understand that because there'll be people that will be listening to you. Well, I was in a car accident. I'm just going to give you my whole thing. I was in a car accident. I had 4 herniated discs, and I was told I was surgical, and I said absolutely not, absolutely not. I will heal, and my body, I don't feel the pain. Once in a while, I'll feel the limitations that the car accident had, but it doesn't. But then there's other people that have that type of situation but haven't healed. Are you saying, and let's understand here, that if you are experiencing pain, chances are you should go deeper to look into the subconscious or past traumas? How would you fill in that blank?
That's a good question. First thing we always say is go get a checkup, because this life is very precious. We want to make sure there's nothing deadly or dangerous sitting there, right? So please make sure you're safe before you do this, all right? And I should also say this is not an anti-doctor message today. Please,
Correct.
anybody
No, no,
listening,
no.
we need beautiful doctors. We need good doctors. God bless good doctors. But this is not, it's their diagnosis, like Dr. Sarno said. They're not performing the wrong modality, it's the wrong diagnosis. They actually have TMS in almost every single case, but they're calling it, by whatever medical term that they come up with that day. And so it's hard to answer that question. You know, um, Somebody comes up and they present something completely different. It's like, oh wow, we don't even talk about TMS sometimes. I talk about their marriage and they heal. I ended up a marriage counselor. I didn't even go to school for therapy or anything like
I
that.
know.
Or we just talk about, their deep spiritual belief. We don't even talk about health at all, and they heal. And so I don't know what I've become here. I call myself a teacher more than anything.
So is it a willingness to dig deeper into the truth that their mind holds or that their body is holding? What would you?
Good question, because when people came in to see Dr. Sarno, he was pretty good at what he did. He was the best in the world. And they would hand him their MRIs and he would throw them down on this desk. And they would say, aren't you going to look at those? He would say, oh, do you want me to look at those? He would say. So he would pick them up for their benefit. He told me he would look at them for their benefit because he knew they had TMS. There was nothing wrong. Forget what the imaging says, right? But the first thing he would ask them is, could you possibly accept the fact that there's nothing wrong with you despite what these testing and imaging are saying? That's the first thing he would say. And he would say about 80% would say, no, I can't accept that. I believe there's something wrong with me. So they were done. That those people were going to live a life of misery. The other 20% would say, yeah, I guess I could possibly, because I do fit the personality type. By the way, what we're talking about here, we call it type T person. All right. He never called it that. He just described the characteristic traits of their personalities, but we called it a type T for tension. There's a certain type of person that generates tension. They want to look good and they want to always look perfect, and they're in the gym all the time and they want to eat perfect all the time and they want to say everything perfect. And everybody has TMS in the world, but there's certain people that generate lots of symptoms. We call it type T for tension generators. Perfectionists, goodists, hyper responsible, anxious, worriers. A lot of them tend to be hypochondriacs at some time, but not all of them, of course. And so we're talking about here, there's nothing wrong with the person. There's nothing wrong with them physically, no matter what the testing says. They have a personality problem. That's what we're talking about. Okay.
Well, I tell you what, our time is like 1 minute left, and I just want to say thank you for those of you who want to learn more. And we're going to get Steve to come back when I have a little bit more time to look at his work. Go to steveozanich.com. If you go to the blog, if you click on his name, it will take you to his website. Steve, this is just the dipping of the toe. This is the dipping of the toe, and I'm so grateful to you to come into the classroom when you've got a busy schedule. I would love to do this again, and I hope that you'll be available.
I would love to, because we just touched the surface today.
That's it. Well, let's get people curious instead of critical, and maybe the next time they'll be ready. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Steve Ozanich. Wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert